All right, soapbox time. One of the most overused terms in healthcare is the word teams. Whole healthcare systems advertise themselves as part of your team or teams working for you. Insurance companies, payers also use this kind of language. We're part of your team. We're on your side. We're working together to make things work for you. What's a team? Let me give you this awesome definition here by some really smart people who've done a lot of research on highly effective teams across different industries, but adapted for healthcare. So credit here to Dr. Salas and colleagues for the WHO's interprofessional framework, which defines teams as the following. And I'm reading here. A healthcare team is two or more individuals with distinct, interdependent roles who communicate and coordinate toward a shared patient care goal and who are mutually accountable for outcomes with membership and interaction patterns. Here's the key piece. Stable enough, communication patterns between them stable enough to develop shared mental models over time. Without getting into the weeds, what is a mental model? It's just the idea of sort of being in each other's brains. Like you understand how each other work enough where you can anticipate what your needs are and how to communicate with one another and coordinate with one another. Here are the elements again. Interdependence, not just co-location or referral. Distinct roles, not redundant scopes of practice. Shared goal tied to the patient, not just to the organization. Mutual accountability, so there's not one person leading while others execute per se. Or some continuity duration. A one-off huddle doesn't build the coordination habits that real teamwork needs. That's the idea. So I think most of you out there, if you're just patients, you've experienced this, right? You expected to go to health organization X, and you went and worked with one person there, and you expected that person to coordinate automatically with the person in that same organization, and it didn't happen. They might say, yeah, we're both part of Organization X and we are on the same team, but functionally, they're actually not teammates. It happens all the time in healthcare. That's why our organization focuses on promoting this idea of teamness across professionals, across care teams, so that patients receive the highest quality care possible. That can only happen if you actually have the elements that Salas and colleagues just talked about. Specific, I'll break this down for you, make it super clear. Specifically in integrated care teams, where you have a behavioral health professional and a medical professional working together. How do they share a mental model? Well, it's down to some of the basics. Like, I understand what my physician colleague, for example, is a psychologist, what my physician colleague is doing in a 15-minute visit. I understand the pressures that they're under. I understand the kinds of workflows that they're dealing with. And as a result, I adapt my work style to work best for them so that when they come and give me a warm handoff, I understand what their workflow needs are, how to coordinate with their medical assistant, how to fit into the visit pattern that they're developing with that patient that they're working with. And then I use language and concepts that I know that we share together to communicate effectively. And they also have a mental model of my work as well. Like they know, oh, these are the kinds of things he's probably going to work on with the patient. They know how I operate, so they know how to communicate with the patient what my role is as part of their care team, and they know how to introduce me effectively as a result. Basically, my medical colleagues and myself, we're in each other's heads. We know how we think. That is the secret sauce to having a high-quality team around you as a patient or you as a family. With that kind of care team, you're not going to fall through the cracks. You're going to have advocates, and you're going to be covered from all the different areas of expertise in a synchronized fashion. You're going to have less unnecessary tests, less unnecessary medications, less snafus with pharmacy. You're going to have a more targeted diagnosis and targeted treatment to tailor to what you really want. So that's my soapbox. Unless your team, your people, actually embody that mental model, shared mental model framework that Salas and colleagues talk about, you shouldn't be using the word teams. At best, you might be a multidisciplinary outfit, or you just simply might be a healthcare organization.